Hello guys, we are going to look at an important topic in medical surgical nursing on liver disorders. The two liver disorders, common liver disorders that we'll look at is hepatitis and liver cirrhosis. We are going to start with hepatitis. What is hepatitis? Hepatitis can be defined as the inflammation of the liver. Hepatitis can be defined as the inflammation of the liver. The causes of hepatitis. What are the causes of hepatitis? It can be caused by microorganisms and non-microorganisms. Microorganism example, bacteria and virus. The non-microorganism example, alcohol, toxins, drugs, gallbladder disease, damage or injury to the liver. The microorganism cause, most of the causes of hepatitis is caused by virus. Majority of the cause of hepatitis is by virus, which is called viral hepatitis. Viral hepatitis have different types, which is designated by alphabet. We have different types of viral hepatitis that are designated by alphabet. A, B, C, D, E. That is hepatitis A virus, hepatitis B virus, hepatitis C virus, hepatitis D, hepatitis E virus. And recently discovered, we have hepatitis F virus. The hepatitis A virus. This type of hepatitis accounts for greater number of hepatitis. It is a self-limiting hepatitis. That is, the onset, it appears and disappears on its own, even without any medical treatment. The cure is, it is easily cured. The cause is by fecal-oral, is through fecal-oral route. Fecal-oral route is the main cause of hepatitis A virus. This is common among people that are living in overcrowded environment or unsanitary living condition, contaminated food, contaminated water, and you can be gotten from shellfish. The incubation period for hepatitis A virus is 3 to 5 weeks. Hepatitis B virus is the second one. Hepatitis B virus is commonly found in semen of body fluids. The hepatitis B virus is transmitted mostly through sex and through use of needles and sharp. They are transmitted through blood transfusion. It is very common in adults and children. The incubation period for hepatitis B virus is 6 weeks to 6 months. Hepatitis C virus is transmitted through blood transfusion and infected needles and are low risk of sexual transmission. The illness is mild in the acute phase and sometimes lead to chronic liver disease. It is the most common indication for liver transplant. People become carriers of hepatitis C virus unknowingly. It is not easily dictated. Hepatitis D virus, this causes infection for people who have active hepatitis B virus. That is, it is also caused through semen or body fluid. It is transmitted through blood transfusion and other ones, just like hepatitis B virus. Hepatitis E virus is common in the United States. Hepatitis D virus, E virus is rare in the United States, but more common in the Eastern Asia, part of Africa. It is transmitted via fecal-oral route in contaminated water. The summary of the hepatitis A, B, C, D, E, and F. I want you to know that hepatitis A and hepatitis C. Hepatitis A is through fecal-oral route, and hepatitis E is through fecal-oral route. Hepatitis B, C, and D is transmitted via needle, sex, and fluids. Chronic hepatitis. When hepatitis is not treated, it now results into a chronic hepatitis. Chronic infection of liver may lead to cirrhosis, liver cancer, or liver failure. It may develop with hepatitis B virus and C virus infection. The clinical manifestation of chronic hepatitis often are mild and non-specific, such as general malaise, fatigue, and enlarged liver. Non-infective or infectious hepatitis. This is caused by non-microbial organism. Example, it's caused by alcohol, which is called alcoholic hepatitis. Toxic hepatitis, which is caused by eating of toxic concoction or toxins that are harmful to the liver, eating of poisonous mushrooms, taking of drugs like paracetamol and tetracycline, the chronic use of this drug, toxic concoction like herbs. Then we have gallstone. Gallstone is, the gallbladder is attached to the liver. When there is gallstone and there is inflammation of the gallbladder, cholelithiasis. Cholelithiasis can develop into hepatitis, can result to hepatitis. Then we have the signs and symptoms. The signs and symptoms of hepatitis are subdivided into three phases. We have the pre-icteric phase, pre-icteric phase, icteric phase, and post-icteric phase. Pre-icteric phase, icteric phase, and post-icteric phase. The pre-icteric phase include A. Flu-like symptoms. In this condition, there is flu-like symptoms. And these symptoms include malaise, fatigue, headache, muscle aches, nasal discharge, and sore throat. Then we have gastrointestinal symptoms where the patient develops nausea, vomiting, anorexia, diarrhea, and vomiting. Then we have joint pain, mild and constant right upper abdominal pain fall under the pre-icteric phase. In the icteric phase, the patient have jaundice, pruritus, clay-colored stool, dark urine. The post-icteric phase is also known as the convalescence phase, where the well-being of the patient improves. Energy of the patient increases. Jaundice is resolved. The medical management of hepatitis. There is physical examination of the patient. They observe the patient for paleness, sign of jaundice. Ask for the history of weakness, general body malaise, pain, and so on. The lab investigation includes hepatitis antigen test. The prevention. The patient are tested for hepatitis. The test for hepatitis A and B is very important. After the test, immunization against hepatitis A and B virus vaccine. Immunization with hepatitis A and B vaccine are given at the first month, third month, and 10th month for prevention of hepatitis infection. Antiretroviral drugs like lamivudine, eptovir, epiva, adifovir, hepcera, ribavirin are given. Educate patient on adequate rest, maintain nutritional intake, avoid strenuous activities, alcohol, drugs that are toxic to the liver. Maintain personal environmental sanitation. Personal and environmental sanitation for cleanliness. And advise the patient to avoid taking of drugs like paracetamol, tetracycline, and so on. Also advise the patient to avoid taking of herbs or other concoctions which are very harmful to the liver. Advise the patient on the follow-up after discharge so that the patient will comply to the follow-up date and adhere to the treatment of the disease. Thank you for listening. Subscribe, like, make comment. You are free to ask questions on my comment section. I will take liver cirrhosis in my next class. Thank you for listening.